At this point, I'm post-op phalloplasty 7 days. I've been in bed for 7 days. The doctor comes in and says, today you're going to try to walk. And I'm thinking, try to walk? What does that mean?
My dick don't work.
This is something the trans community does not want to talk about.
Now, bottom surgeries, these are huge money makers. Again, I think this has to be an underestimate that they're quoting around $20,000 for a phalloplasty. There's been different things that I've read that said it could be up to $100,000. Dr. Winokur, who's our surgeon, says that there's entire clinics where the entire clinic is supported just by their phalloplasties, and that is like a fraction of the surgeries that they're doing. These surgeries are labor intensive, they require a lot of follow-ups, they require a lot of OR time, and they make money. They make money for the hospital.
Okay, so we're going to get into this today. I've been holding off on this because I think that some people just want to keep things hidden in the trans community, and I didn't really want to get involved in drama. If an adult wants to do something to their body, they should be able to do it. I don't know. I guess I have mixed feelings about that. Like, if an adult wants to cut off their arms and legs, should we let them do it? Or would we say, wait a minute, something's not right here. We need to, back up a minute. I kind of feel the same way with what they call phalloplasty, which is bottom surgery, which is the surgery to get a penis for a female to male trans person. It wasn't something that was done a lot when I was transitioning over 30 years ago. And for a while there, it wasn't really being done a lot. But I have seen an upswing in it with the invention of TikTok and other trans men talking about it as if it is a good surgery, when I know it is not a good surgery. And I will tell you that I see more people who wish they didn't get it than people saying that it's the best thing that they ever did for themselves, in my opinion. Now, I'm going to get pushback from the trans man community. I don't really care. I just don't care. I don't care what you think. I don't care. This is a service to the young trans people out there who are even thinking about getting the surgery. I have lived a long life without that surgery. Dysphoria sucks. It's not fun, okay? But you got to realize there are some things you can do and some things you cannot do. And I'm telling you right now, you can live your life perfectly fine without getting that surgery. And in my opinion, that surgery should never even be on the table. If you remember the guy I interviewed named Scott Nugent, he has so many complications from it. He has been raising awareness around it. Yet there these doctors are. It's an experimental surgery. And they're just like they're experimenting on kids. They're experimenting on these young trans men who are females who want to get a penis. Now, thanks so much for liking and subscribing to this channel. Thank you so much for all the awesome comments. And this is going to be a little bit of a graphic. I think well, there's not so much graphic stuff. I think there's more kind of just take care of yourself. Some of the stuff these people say, it can be a little bit much, I think. So I just want to give you that little bit of warning there, but I think you can handle it, and I think it's very important. So with that, let's move on to this next video.
I am a reconstructive urologist, and while I do not do gender assignment surgery, I do a lot of reconstruction. And in my training, I did a lot of reconstruction on the urethra and on the pelvic floor. And I think it's important to know that with phalloplasty, with constructing a urethra, that is a procedure that is fraught with many complications potentially. It is very tricky to recreate a urethra.
There you go.
You don't think about your urethra until something goes wrong with it. But the tissue that's used the tissue that makes up the urethra is very specialized. It's got glands that lubricate. It has special properties that allow it for the passage of urine through that. And if you think about a phalloplasty where you're creating a penis out of other tissue and then creating a urethra, there are many different complications that can occur, such as scarring and strictures. And there are studies showing that strictures are very common
Yep.
And what that means is that it makes it very difficult to urinate and requires numerous procedures to open up the stricture, to dilate it with a series of metal rods, or to reconstruct it. So it's deciding to do a phalloplasty, to go from female to male and create that urethra, is committing yourself to years of monitoring the urethra, working on the urethra, dealing with urethral complications, and numerous surgeries and procedures. So it's something that needs to be entered into very cautiously and wisely.
Thank you.
And something that is going to be a huge commitment with a lot of pain and potential infection, which could spread to your kidneys and throughout your body.
Wow.
As well as numerous other things that can go wrong.
Thank you.
So just something I think you should know as you're thinking through doing gender reassignment, gender transition.
That's a real medical professional. That person cares. Okay. They're not telling you, oh, you shouldn't do this. It's weird. They are actually telling you the truth. I again repeat also, I don't know if you remember, I did one, I'll put the links to the video I did of a young kid who went through all this. He was like 20 years old. He ended up dying from all of that, from kidney failure, from all of this insane infections he got. Nobody would help him. The doctors who did it to him were literally ignoring him. The same thing happened to Scott Nugent. I mean, all of these people, so many of these young people say that they're not getting great aftercare, all of it. It's an experimental surgery. And I just can tell you that, thank you, God, that I never did it. I'm not telling you that I wish I didn't have one. Of course, that was part of my dysphoria. But I just saw the things back in the day that I was like, no way is it worth all of that surgery, hours of complications, years of complications, if not forever. It's just, they take a flap of your skin off of your forearm to create the phallus. And there's just all these things that they take from your body to create this thing that I don't get it. I actually don't get it. So I hope that some young trans guy is watching me right now. You don't need it. You do not need it. Some things you're just going to have to deal with not having for the rest of your life. It's serious. It's not worth it. It literally is not worth it, in my opinion. So now, as she told you, you're going to have a lot of complications. Your urethra, they have to create a whole new one, right? For you to urinate out of. So that's a whole other complication. Think about creating a penis. It's like a very difficult surgery that they don't even have down. It's different to create a vagina than it is to create a penis. And so now I'm going to show you a trans guy, okay, that says something completely opposite of what she was a nurse, I think. She's a nurse, told you, okay, who deals with this stuff on a daily basis, okay? And I didn't feel like she was being transphobic. I think she was being very authentic and helpful.
Two most common complications when it comes to phalloplasty has to do with the urethra. One is a stricture, which is the narrowing of the urethra, and one is a fistula, which is a small hole in the urethra. They're relatively easy fixes and usually just need a catheter in for a longer time.
They're relatively easy fixes, and you only need a catheter in for that. Is just not true. Are you going to believe this person, or are you going to believe an actual nurse who actually works with urethras on a daily basis? I'm gonna go with the nurse. I'm gonna go with the medical people who have nothing vested in it. This person has something vested in it because he got that surgery. So relatively easy. What does that even mean? Do you know what a catheter? I don't know if any of you out there has ever had a catheter. It is not fun. It does not feel good. It is horrible. I see guys here who have had catheters in for a year. Like what? Because they have to get them in and out because they're constantly having infections and UTIs and all kinds of stuff going on with themselves. So the audio on that is a little funky because I had to take the music out for copyright, but I think you can understand him, I hope.
I had multiple strictures, so for me, they took a graft of healthy tissue from behind my ear to replace where the stricture had formed. Another common donor site is from the cheek inside the mouth, and it's called a buccal graft.
Wow.
For more about my phalloplasty or my transition in general.
Wow. So he had to have it done by taking more chunk of something out of his ear and another thing here and another thing, acting so nonchalant about it. Just totally like it's normal to have all of these surgeries. And it's like relatively like that, that's the stuff and why I'm exposing this, because they are not being honest with you. They are not being honest with you. You don't want to keep going in the hospital to have surgery after complication it ruins your life. It actually ruins your life. I don't even like being sick, let alone going to the hospital every month or 2 or year, because you have another infection. So the next one I'm going to bring up.
What up, y'all? It's Jay here. I had phalloplasty in August, so about 4 months ago. As you can see, everything is healing up pretty nicely. It looks good.
Wow.
It looks good. I'm just getting on here to talk about a complication that I've had since getting surgery, and that'd be my fingers. Basically, it kind of started out as my cuticles, like being a little bit swollen and tender, and then it's progressively gotten worse since then.
What is it?
Basically, when I brought it up to my surgeon's attention, they said that they didn't really know what was going on and just kind of brushed it off.
Wow.
It's only gotten worse since then.
Okay,
so I ended
great.
up going to see a hand surgeon specialist at their office, and they basically said that it was a pyrogenic granuloma. I think that's
So the guy's just gonna go in to get a routine penis, and then it ends up complications, said it plurally, and now his hand is now something going on with his hand, and the doctors don't even know what that is. Oh my God. Wow.
That's the name of it. And then they did a silver nitrate treatment to it, which basically is like this long stick. It looks like a match, but you like get it wet, and they put it on the stuff that was coming out of my freaking cuticle.
Oh my God.
They put it on there, and then it like turned everything black and like basically burned off what looks
What?
It looks kind of like this. They burned it off, and so now
What is it?
it's fallen off, and it still looks like this. And now my fingernails, if you can see,
Gross.
they're like peeling at the base. These two, and then these ones look like this. Is anybody else like? Am I okay? Like, what's going on? Anybody else experience this? It's been 4 months. 4 months. 4 months, and this is what I've got. I don't know. And nobody seems to know what's going on. No one knows, like,
They don't.
why this is happening. They've never seen this before.
Mm-hmm.
I'm at a loss. Like, I don't know. Please comment if you've had anything like this, experienced anything like this. If you know anybody that has had anything like this happen, please comment and give me some direction.
Wow.
I have an appointment next Monday to, I guess, hopefully surgically remove the whatever's in here. I don't know. I'm at a loss. I don't know what to do.
Oh, I feel so bad for these dudes. I'm sorry, dude, man. You guys don't deserve this. You don't deserve this. It's like, I just wonder, like, what are the steps to even get phalloplasty? I don't think there's long-term mental health. I think you can be saying, I want phalloplasty, and as long as you got insurance or money, you get to have phalloplasty. I also wonder why within the trans male community they aren't being more honest about this. It takes, it just takes a lot to talk about this, and I'm pretty sure of it. But at the same time, why are people sort of telling guys to get this surgery when it's clearly a complete total mess? And not only the physical pain, but the mental pain that you will now have to deal with for the rest of your life, because I'm sure you're pretty at a loss for any sexual interaction after this goes haywire. And again, what is happening? I really feel like it's some kind of experimental phase to use more to like figure out it doesn't work. What?
So, y'all, I have not spoken to y'all probably since like March or whatever. So, yeah, I'm gonna just give y'all a whole month of a rundown, because as y'all know, I had AOT phalloplasty March 7, 2024, and ever since then I've been having like literally straight complications every week.
Wow.
Every week.
Wow.
I've had a total of 4 surgeries, 2 emergency surgeries, and 2 of them scheduled surgeries. I recently just had my 4th emergency. Well, no, 4th surgery, as in 2 days ago. And that one is 1 out of 2 of the emergency ones.
Wow.
And I just got released from the hospital today. Right. So, yeah. So, I'm going to give y'all a little rundown. So, as you guys know, I had surgery March 7th, okay? You guys also knew that I had to go to rehab after that. So, I had surgery March 7th.
So if you look at his arm, he's got this bandage. That's from the donor site where they have to take the skin. You'll see. I have another guy on here. You're going to see more of it. How they literally have to rip a flap of skin off your forearm in order to create the phallus.
I got released, I think, March 15th. March 15th, I got released to rehab because I was going to start treatment there, learn how to rewalk and all that extra shit. Right.
What?
March 15th, got released to rehab.
Oh, yeah, that's part of the surgery. You have to learn how to re-walk. Yeah, I said that. You have to learn how to re-walk after you get the phallus put on because it's so traumatizing in that area that everything is just a mess.
If you guys ever been to Chicago, y'all know them fucking potholes is horrible, so that was the worst ambulance ride to rehab ever in life. But arriving to rehab, I was only there for 2 days. So I got released Friday. I was only there Friday, Saturday, and then Sunday I had to go back to the hospital because my groin area where my penis is was like real heavy. It was like real heavy. It like my bladder felt like 20 pounds. So I had to go back to the hospital. Turns out I caught an infection. Don't know how I caught it. They don't know how I caught it because I literally just got out. Everything in the hospital was sterile. Literally everything, to my knowledge. I honestly don't think everything in the ambulance and everything in rehab was sterile. So that's how I think I got it. So yeah, ended up back in the hospital for the infection. That was March 19th. Literally just got released. No.
This guy has like 4 parts to this thing because he keeps going in and out and in and out. He's over it. He's literally over the fact that he went and did this to his body and everyone just let him do it to his body. Like, why would they just let him do this to his body? I'm just speechless. I will say it again. I did not have that surgery 30 years ago and I have lived a fulfilling life. I have 1 surgery, okay? 1. I had a complication with hormones because that's just how it's going to be. Okay, that could be prevented. And I have taught young people on how to prevent that. Yet that's a whole other conversation we to have because I get called transphobic and all kinds and a liar. So this community is so insane that they perpetuate these lies within this community. And then these kids get stuck and caught in it. And then they do these insane non-functioning surgeries. And then their whole life, literally, your whole life is ruined for the rest of your life. Not mentally and physically. I'm so over it and disgusted by this whole thing. So this guy I'm going to bring up next, he has a whole, talks about an update in his life but it's pretty much all the normal stuff. Like I've been hormones and he looks great. He just, looks like a dude, like whatever. Looks like everything's working out fine. And then he gets into the fact that, his hair is balding, which is one of the side effects. And that's going to have to deal with that. And it's not all roses, friends, to transition. There are things that happen to your body that you're like, what? Like, yeah, that's a fact. So you better really be prepared for this when you do it. It's not just like, whoa, everything is so trans joy. So that being said, then after talking about his thinning hair, then he goes into his bottom surgery. So I'm going to start the video from there.
And as far as bottom surgery goes, so I had a complication, pretty within the first week of having surgery, which I have a good sized fistula, meaning there's a hole in my urethra.
Okay, there's the hole in the urethra. Again, pretty much all the dudes' complications, that's the number 1 complication.
In the last month or so, I noticed
Disgusting.
I've got like another, it's kind of veering off to the left
Wow.
in another area. I'm sure it's probably been there for a while. Maybe I just now noticed it. So I'm pretty sure there's another fistula.
Oh my God.
So I did have an appointment with one of my team members at Kaiser, last month, and we talked about stage 2. I've been working on getting electrolysis done still on my arm.
Because remember what I told you? They have to take a big chunk of your arm skin out, and if there's hair on it, they can't create the penis with hair on it because it will grow into your urethra and cause tons of... So you got to make sure that everything is clean. I mean, it's just I think there's 4 or 5 stages to phalloplasty.
That's also probably another thing that's changed too, is the hair on my arms are definitely thicker than they were way before. I always used to shave them, but now that I'm doing electrolysis, I have to keep them kind of grown out. So definitely changes there as well. But talking with my nurse at Kaiser, we're going to shoot for probably January. I should be done with electrolysis by then. And she'll give me the green light for ready to go. Hey guys, Flynn. So transition update, complications update, I should say.
Complications.
I saw the doctor on Friday, very long day. I saw 2 doctors. First one, she basically said that in her experience, she doesn't know that the hole, because it's pretty large, she doesn't know if it is going to bridge the gap and come together. And in her experience, it may have to be sewn closed. She did another test on my urethra to see if there was any fistulas forming, which basically is a hole in the urethra, and or it starts to go a different route other than where it should go through, which is right through the tip of the penis. So she basically squirted like a lidocaine / saline solution in the tip and watched and see if it went through and out the hole that's now down there. She said it did kind of dribble out just a little bit out of a small area. So
wow.
To her, that was caused sign of a fistula there. Not a large one, but as of right now, that's what it looked like to her.
Which can cause infections, which can cause more complications. Notice everything is complications. It's not a complication. It's all plural.
If I were to have surgery, she said at minimum like 3 months.
Wow.
So I might have to extend my leave to get that repaired.
Wow.
And I guess they kind of do it like a transplant list. Because I have complications, if I do have to have surgery, they put me at the very top of the list. And so those who've already had this stage and haven't had any issues, I hate to say would get bumped so that I can get mine fixed.
It just goes on and on. He's just going on and on about this complication and going back into surgery, and I have to wait 3 months, and then another one comes. It's already hard enough to transition. I just don't understand adding this next layer of complication to your transition. And this is one of the reasons why I have always been so outspoken about not getting the surgery and just keeping my vagina and learning how to deal with it as a man. And it has helped so many trans guys write me and tell me, thank you, Buck, for having that conversation. And and I just want to reiterate, it's not that I am telling you not to do it. You go right ahead and do it. What I'm trying to do is show you that you can actually live your life without going to a space like this to have all these complications. Work on your dysphoria. I had the same dysphoria that you had, and I worked on it so hard that I let it go. And I don't think these people are getting enough mental health therapy to walk through this? And why is this need to have a penis so bad when this is what's going to happen to most of you?
I've had an infection for 4 weeks. Let's talk about it.
My God.
It's currently 3, almost 4 a.m., and I am 4 weeks stage 3 phalloplasty. Now, if you don't know what that is I got an arm graft taken to create my phallus down below.
There you go.
And I recently got a device implanted that will help me get
Erect? It helps me get erect.
That happened 4 weeks ago, and I got 1 testicle implant as well as a pump that reaches into a cylinder that fills with saline to help me get
Erect.
So why have I had an infection for 4
Yeah.
weeks? Well, when the device gets implanted, there's a lot of bacteria that can possibly get involved.
What?
And when that gets implanted, because it's a foreign instrument, it can oftentimes cause an infection.
Often.
So this has manifested for me as a low-grade fever for the last 4 weeks. I think I'm finally on an antibiotic that's working. It's been the 3rd round of antibiotics.
Wow.
So, if by chance these antibiotics don't work, the next stage for me would be to get the device re-implanted, which obviously I'm not hoping to do, but
oh my God.
that would be the next step if I needed to take it. Now, do I regret this? No. I feel so much more comfortable with my body.
Sure.
Because of all of the surgeries I've gotten, especially this last one. And I know that being erect is a big priority for me and leaving my gender dysphoria. So, no, I don't regret this. But, yes, I've had an infection for 4 months.
Do you all know what I think it's called? Do you know what I think it's called? Cost sunk fallacy, where basically you're too far into it to come back. And okay, I'm gonna just say, fine, dude, you might not regret it, but there's something in my heart, and I'm gonna just give you my opinion that I don't believe you in any way, shape, or form. I think that if you now have the chance to not do it again, you probably wouldn't do it. There's no way you're okay with this. I've watched your whole TikTok. You're in and out of the hospital constantly, in and out and in and out and in and out, and now you move somewhere far and you have to take a bus and a plane to go see your surgeon in California because it moved to like somewhere else. And
My dick don't work. POV, I have to go see my surgeon, post-op fallow, stage 3. Now, usually we would just drive down the highway, but recently we moved to Washington, and my surgeon is in California, so we hopped on a plane, and we went to go see him because I was in pain every time I wanted to get erect. I haven't done a fallow update in a while, but things have been kinda rough. Not gonna lie, I've been having issues with my perineum, where there's lots of skin issues and pain, but I've seemed to be able to manage that with some lotion and trimming and cleanliness. But I'm having a lot of issues with my erectile device. It seems to be that it's bunched up at the base, causing it to not fully go into the tip and get erect. I will have to get this fixed.
you know, no way. I don't believe it. I just don't believe it. And really, you did all this just to get an erection? This is why they create products that are called, I don't even know if I can say it on YouTube, but I'll bleep it, called a dildo. Seriously, like really? Come on, man. I just don't believe it. I just won't. I will not believe that this guy feels completely okay with all of this stuff he's been going through. The infections, the having to possibly have resurgery again, all of it. Nope. I don't believe it. Nope. So the next one I have.
All right, guys, so we got another update. So the problem that I'm having and that they saw in the test is that I'm not emptying out my bladder all the way. So I'm peeing, but I'm not emptying it completely out.
Wow.
And
Wow.
I know that I've been doing that because I've been feeling that I haven't been emptying my bladder out all the way. Like, it still feels like I have to pee.
Wow.
Not like in a way that I have a bladder infection, but it feels like I still have to pee, but I kind of just don't because I can't get it to finish for some reason. So because of that, they're gonna go in what's called the voiding trial. So I'm basically gonna start peeing on my own But at the end of each pee, I have to take my cap off of my catheter and then measure the pee that's left in my bladder. And if it is a lot of pee, then the surgeons have to get involved. So
Did you notice he also has another catheter inside of him? And then now, if it doesn't work, the surgeons have to get involved.
hopefully that's not the case. But by Monday, I'll know.
Wow.
So I have to report back on Friday about how much pee has been left in my
Wow.
bladder every single time I've been peeing today, tomorrow, and Friday morning. And if it's a lot, then the surgeons have to get involved. But if it's not a lot, then I should be fine to proceed to go back to work and to schedule my stage 2 bottom surgery.
Oh my God. So he's not even finished. He's going, this is his first stage. Remember, it's 4 stages. I would be so over it. I just can't even understand. How are you enjoying your life? Okay, so then I have this guy. I mean, I could show you so many of these. I can't fit them all in the thing because there's just not enough time.
It basically feels like I'm peeing my pants. It feels like the pee is going how
What?
it went pre-bottom surgery, through its little path. And then I'm expecting the feeling of it releasing out at its previous urethral opening, which is no longer there. But instead, it keeps going. And so for a little bit, there's like this delay as it's going through the longer urethra, and it feels like it's pooling there. It feels like I'm peeing my pants, even if I'm not wearing pants. And it is a very uncomfortable sensation. The first time I did a voiding trial, I did it in the shower, and it burned so bad. It wasn't very euphoric, but afterwards, you know, it is.
It wasn't very euphoric. You see what's happening? How does any of this sound fun and awesome and trans joy and penis joy? How does any of this sound like that? It sounds insane and wrong. I just want to bring this last one up so that I started with, so that you don't forget where I started. Because this is very, very important part of this conversation.
Now, bottom surgeries, these are huge money makers. Again, I think this has to be an underestimate that they're quoting around $20,000 for a phalloplasty. There's been different things that I've read that said it could be up to $100,000. Dr. Winokur, who's our surgeon, says that there's entire clinics where the entire clinic is supported just by their phalloplasties. And that is like a fraction of the surgeries that they're doing. These surgeries are labor intensive, they require a lot of follow-ups, they require a lot of OR time, and they make money. They make money for the hospital.
If that right there doesn't make you see what is going on in this whole trans, gender-affirming care, medical scandal, this is what's happening, okay? It is. It's about money. It's about patience. It's about lifelong patience. They don't like people like me. I went in and out. I'm done. I have to just take my hormones, everything else. I take care of I take supplements. I take things. I work out. I take care of myself. I'm super healthy. They don't like me because I'm not their patient. Okay. So that being said, I just wanted to expose to you. I do not believe this is a healthy part of transitioning, in my opinion. You can push back on me all you want. And if you got it and you're happy, I'm happy for you, friend. But we got to be honest. This stuff isn't what everyone's trying to make it out to be. And a lot of you young people are suffering from getting this surgery. And so I just don't like the fact that there's just so much dishonesty going on in the trans healthcare system. It's disgusting. So with that, thank you all for liking the channel, for subscribing, for these helping me get these videos out there. It really means a lot to me. And I'll see you guys all on the next one.